take the questions. There were few questions which were not answered, I think, on the last YouTube. So if you have it, please write down so that I'll complete that first and then go to the next session. So before that, I would like to make you understand one thing very common, that some symptoms and some rubrics in your practice would come, very frequently, and that is important to know that rubric. Otherwise, you will forget that rubric and go to something else. For example, every person every person is sensitive to something. The sensitivity, that is an important factor in case taking. Now, some persons could be sensitive to the most trivial elements. Some person would be sensitive to some disorder. Some person would be sensitive to drugs. Otherwise, what would happen that normally when we get a patient who says that I've taken a lot of allopathic treatment, they come to us and we give Naxomica. It is not that. So sensitive to drugs, there are more remedies in the rubric. For example, Naxomica or Sepia or Cilicia, Lycopodium. Or the patient is very emotionally sensitive, or sometimes the patient is sensitive to everything. You know, or the patient becomes sensitive during a disease process. For example, if the patient says that I become very sensitive to light, noise, touch, taste, everything during headache. So there's a cluster of sensitivity during headache. So this is a very important rubric, sensitivity. Gradually, I'll give you some examples and then go to some elements and mathematica and the remedies sensitive to something. In between, if you have any questions, I can always answer those questions. So good afternoon, Dr. Babel. Hello, Dr. Babel. Dr. Uh, Bharat. Good afternoon. Welcome. So I think my assistant doctors are already writing the welcome note. So first I'll take sensitive to the most trivial element. Most trivial element. थोड़ा भी whatever happens, a little thing happens, little excessive heat, excessive cold, excessive dust, excessive noise, excessive this, and the patient is very sensitive. He starts getting angry. He gets XYZ symptoms. There's a very interesting rubric and a very interesting and a very surprising remedy, Naxomica. Naxomica is the only drug which is sensitive to the most trifling element. In homeopathy, there will be a lot of surprises, where you sometimes feel that this drug would never come in our repertory chart, and if you take a rubric properly, you will get some remedies which you never thought of. This is why I want to tell you something about Naxomica. Means Naxomica is sensitive to the most trifling element. Only drug in our mathematica is Naxomica. One sensitivity, when the patient comes and tells, Doctor, I don't like, people hitting dogs in the streets or beggars in the streets, people shouting on the beggars, and people doing something cruel on the road or in the life or anywhere in the world. I don't like that. So sensitive on hearing cruelties. I had a case where the patient said that, see, there is a war going on between Russia. I don't like it, and I feel very sad every day morning. I get up in the morning and I feel that why the war is happening. What can I do? What can I do for the war? I make some videos and all, but I feel very unhappy. I feel very down and low because of this sensitivity. Now see, war is going on so far, but this patient is sensitive to this, somebody dying in the war. She is very sensitive to this. So there's a rubric called as sensitive to cruelties on hearing. The remedies are calcarea carb, and I think on the latest edition of Complete Repertory they have also added Hiparsulf. So there's one question. Good afternoon, sir. Heel pain worse from walking, stepping on the floor, better by hot applications for 6 months, especially rising from bed in the morning, gradually better. This is a very common disease that is called as plantar fasciitis. Very painful disease. It takes time for this disease to get cured, because see, whenever a part is diseased, you have to give that part rest. You can't tell the patient don't walk for 15 days. He will get up from the bed after rest, he'll get a lot of pain, and gradually when he starts walking, the pain is better, and better by hot applications. So this is a classical picture of rest talks, better aggravation by first motion. But but Restox every time will not treat the ailment. I have seen many cases in my practice also, in my early days of practice when I used to use Restox very frequently, but with no result. In this case, you have to think two or three things which are very, very important. How is the pain? Where is the pain more? And how is the pain better? I'll just tell you the reverse part, Dr. Ram Prasad. When the patient says that whenever I walk on the marble of my house, which is very cold, I feel much better. I feel much better. Okay, this is the drug Ledampal. In your case, the patient is better by hot application. Exactly reverse of Ledampal. So you have to have remedies which are chilly remedies. For example, arsenic album. For example, all chilly remedies, so Hipar sulf. These are the remedies which you can think about. But in this case, whatever remedies you are giving to the patient, whatever remedies you are giving to patient, make sure that you give this remedy in LM potency. Hello, because I have seen in case of plantar fasciitis, LM potency is it works better because you require a lot of repetitions. Hello, are you with me? So there are few remedies which you should think about. First is arsenic album because it is better by heat. Second remedy you must think about is Kali carb. Third remedy you must think about is calcarea carb. Fourth remedy you must think about is viratramal. Of course, Rustox, phosphorus, and conium and causticum are also important. In this, make sure that you take few symptoms of the at least one symptom of the mind and one symptom of the local part, and you can get the drug picture and prescribe the remedies. Frequently used remedies in my practice, if that was the modality, I can tell you causticum, Rustox, phosphorus, and Aconite napellus. I have used with good results. Yeah, Navjot, and I hope you give that remedy to your patient and the patient would be better with that. Don't worry. So let us go forward. In fact, there are so many questions already. Okay, I hope Dr. Ram Prasad, no, I hope you have understood the answer. Okay, sir, feels lethargy in morning even after taking sleep, aged 48 years. See, if you are feeling lethargy in the morning after getting up, you have to find out the cause, why it is, why you are feeling that way. No, there is always some cause behind whatever happens. You can't just have something like this. I'll just tell you one symptom of I think one. If my students are hearing this, they would answer this question properly also. There is a remedy where the patient says that whenever the sleep is unrefreshing, more tired on rising when retiring. So when I go to sleep, I'm tired, but when I get up in the morning, I'm more tired. This is the only phrase which suits your case. Otherwise, you have to have a cause for why the sleep is unrefreshing. Maybe he is not happy with his career, with his family life, with his financial life, whatever reasons. But there's a rubric called as the sleep is unrefreshing or the patient is more tired when rising rather than when retiring. So if my students are there online, they can answer these questions very easily. Macphos, yeah, Macphos. There are a lot of remedies. I just told you the remedies which I use frequently in my practice. सर acute केस में लो पोटेंसी देना ठीक रहता है. In acute potency, is it good to give low potency? So my answer would be, if your medicine is right, potency would work. Don't go above 30 potency. But in today's world, according to the 6th edition of Organon, if you give LM potency, I had a case of fever where the fever was 103. The patient came to me. There was fever. I gave the patient Aconite 0/1 every 15 minutes, and I told the patient to report after 1 hour. So Aconite 0/1 treated the case within 1 hour. Repetition every 15 minutes. Sometimes in case of acute disease, or sometimes if I have to repeat a case where repetition is required, I repeat the remedy even in 10 minutes also. So repetition in LM potency is a bit safe. Okay. I hope, yeah, Dr. Vishaka, Mac carb is there, of course. See, there are a lot of remedies. Mac carb is there, bryonia is there, conium is there, Hipar sulf is there, sulfur is there, opium is there, a lot of remedies. But I was just telling you what to think in this type of cases. Yeah. Very nice. So, Dr. Vishaka, I hope this was a question asked before also, so I think everybody knows the answer. So, let us go forward. In MAC-CARB, remember one symptom is very, very important. In MAC-CARB, one symptom is very, very important, and that is, uh, the patient has inordinate craving for meat, especially in children. Especially in children. And if you see that line in Allen's keynote of tuberculous parentage, means if the parents are suffering from tuberculosis or the history of tuberculosis, that child has lot of inordinate craving for meat, and then you can basically add the symptoms of MAC-CARB like persons of irritable disposition, nervous temperament, the body always has a sore smelling like rheum. This is how you read Allen's keynote and read your Mater Medica. So let us go forward. So I was just telling you something about sensitivity. I hope sensitivity you understood. I think I told you something about Nux omega, Calicaria carb, and Heparself. Now there is a condition where the patient is sensitive, very emotional. You can say the patient is emotionally very vulnerable. Emotional, whatever happens, little happens. If the child is got wet in the rain, reached late at the house, the mother did not call, or he could not talk with the father, he could not talk with a friend, anywhere, the patient is very emotionally sensitive. Think about causticum, think about thuja, and there's one rare remedy prepared from moonlight, and the remedy is Luna. Okay, so this is the sensitivity in relation to emotional. There are some cases where the patient says that he is sensitive to everything, whether it is external impression, it is emotional impression, it is anything. He is sensitive to everything and anything. Then the remedies are Cantharis, and I think in the repeated is written Macphos. So sensitive to everything. And of course then you have persons who are sensitive to noise or sensitive to what do you call voices, sensitive to odors. This is a very, very sensitive to pain. The patient comes and tells, doctor, do anything, but first treat my pain. I'm ready to suffer from this, but the pain has to be better. If the pain is better, I'm happy. So these are the sensitivity that you should remember, because hypersensitivity more than normal becomes psychosyphilitic. So if the patient is sensitive to pain, for example, the patient says, sir, the patient was suffering from severe acidity. So much acidity the patient could not eat, and because of that there was a lot of pain. So the patient came and told me, sir, no problem with the acidity, I'll not eat also, but please treat this pain. So I gave the patient a dose of Lycopodium 30. Lycopodium is sensitive to pain. This is very, very important. Then you have sensitive to reprimand. The patient comes and tells you that whenever my mother scolds me, my teacher scolds me, my child suffers from fever. There are a lot of cases in your practice. Okay, my mother was not happy, she scolded me, my father scolded me, my brother scolded me, my teacher was scolded me, and now sensitive because there was criticism that I could not study properly, I could not get good marks, or did not perform well. So sensitive to criticism. There's one rubric called as sensitive to criticism. And then you can have, sacramal, carcinosin, medorinum. Now, there are some children, where the patient comes and tells you that, doctor, I don't mind people, telling me about my mistakes, but they should tell my mistakes in a very pleasant manner. I don't like people, becoming rude to me. They are talking very bad to me. I don't like that. I don't mind people criticizing me. Now, this is a very, very important. Try to differentiate between criticism and rudeness. Both symptoms are different. In our repertory, both rubrics are different. Sensitive to rudeness. The child says, I don't. I had a very close, one of my close family members, and the mother said, my child is absolutely fine. If I scold him, if he does not perform well, he accepts it. But I have to tell my child very pleasantly, not in harsh voice, not in bad tone, then he is happy. So sensitive to rudeness, one of the very frequently used medicines which I use in my practice is Staphysagrina. Of course, that is not the only medicine. Sensitive to Rudinase Staphysagrea, Calcarea car, Pulsatilla, I think Natramur, and Magmur is also there. I don't know exactly, but these 4 or 5 remedies I have, have seen in my practice having fantastic and very good results in my practice. I'll just take one. See, you can ask questions, because if I start Mater Medica, the whole half an hour is lost because of what I want to speak. I will not be able to finish it off. Medicines to cure shivering and cold in winter. It is not a disease state. The patient lacks animal heat. Give him some, what do you call it? Some woolens, proper woolens, and the patient should be happy. Unless the patient has a lack of animal heat, take a good case, and it should be a chilly remedy. सर आप बॉम्बे कब आ रहे हैं? अनीसा शेख. आई एम कमिंग टू बॉम्बे ऑन द 30th नवंबर 30 नवंबर को. ओके, सो लेट अस गो फॉरवर्ड. Now, you understood sensitive to reprimand and sensitive to rudeness. Hello, everyone. I hope if you understand, just tell me something so that I know that you understand what I want to tell you. Otherwise, I feel I'm talking to the computer. Okay? Hello? Yeah. So let us go forward. Sensitive to. Now there will be a condition where the patient says, yeah, so I have got 1 or 2 hearts. So I know that you understanding. So there is one condition. Now we have told something about sensitiveness. There is one condition called that the patient is not sensitive to anything. And there's a beautiful rubric. Want of sensitiveness. Want of sensitiveness. Patient does not feel if loud sound is there, bad odor is there, he is so immune to that, he does not care what is happening. He is not sensitive to that. The first remedy that you should think about is opium. Opium has given me very good results where there is want of sensitiveness. The second remedy, again a very, very rare remedy, hydrocyanic acid or prussic acid, you can say it. And third remedy which I have used in my practice is phosphoric acid with very, very good results. Okay, now somebody has told me on the WhatsApp, sir, if there is a cold wind and there is a dry wind and wet wind and stormy weather and all, if the patient is sensitive to wind, what to give? If I am not wrong, there is a rubric in the repertory, sensitive to wind. The remedy, one remedy I remember, I don't know how many remedies are there, but I think one remedy is, I think, chamomilla. I have used this whenever now in Nagpur it is raining sometimes it is very dry, it is sometimes windy, quite changeability, So when Dulcamara and natrum sulph normally it does not work properly, then I give chamomilla with very good results. Okay, so this is in short something about sensitiveness. So there were a lot of questions on my Facebook and WhatsApp that how to understand sensitivity rubric. So boy aged 15 years having dengue, NS1 positive before high grade fever, hospitalized, now fever disappeared, wants to lie all day, watch TV, lazy, constipated, demand for water, only drink whole at a time. So even mother asks for a food and tell him to go to the washroom, then he goes. So see, whenever the patient is suffering from fever, okay, and now the fever is better, what to prescribe? This is a very, very interesting question, and a lot of cases will come in your practice that fever has gone, but still the patient is not out of it because he is suffering from weakness. Now there are two remedies which I have used very, very frequently in my practice. That weakness is there, the patient was admitted to the hospital for 3-4 days, the fever is okay, he comes home with a lot of weakness. So doctor has prescribed him tonics and vitamins, but he's still not better. In this case, two remedies have been very, very important in my practice which I have used. First is China. Second remedy, again, I'll tell you three. Second remedy is Apis mellifica. And third remedy, when I failed with few remedies, then I used this remedy, and that was Arenia diadema, spider remedies. Very, very important remedies. These are this. Now, if you see either it is because of prolonged fever or after fever, these remedies are very, very important. Of course, a lot of doctors give Avena Cetava, Carboveg, Alpha Alpha, tonic and all, but I have not used in my practice. Of course, I have used Avena Cetava in my practice if there's weakness after fever, but the patient is suffering from coryza, which is dripping. Then Avena Cetava works very well. Sometimes there is weakness without any cause, everything is okay, then I use Elytris Ferenosa in low potency, that is 6 potency in repetition. Okay, this is how I practice. Ferritinism, dengue. Have a patient with very swollen leg from knees down, calf, ankle, feet. Very painful to touch. When lying down, the edema goes down, but when standing after 5 minutes, the swelling is there. What is the age of the patient, Dr. Alexandra? Age of the patient? Navjot, I hope you give one of the remedies and next time the patient is better. That is important. Yeah, Dr. Alexander, age of the patient. Now, see, we have cases uh, stinging in the calf and bursting of the feet. Age is 93. Normally, what happens to Alexander, this is called as postural edema. At a certain age, the body lacks that muscle, the tissues and the valves are so weak, it does not go up. Oh, sorry. Yeah, so this is postural edema. In this case, I would say that depending on the age, also the remedies are can change, because at this age, at the age of 93, I think that's the age. Yeah, 93. This is postural edema, weakness of the tissues, weakness of the muscles, and all. In this case, because there is a lot of pain, there's a lot of edema, and there's a lot of congestion. There are 3-4 remedies which actually come to my mind. Of course, first 2 remedies are very, very common. By touch, there is pain and all. So you can think about inflammatory remedies: Apis mellifica, belladonna, arsenic, lachesis, colchicum, sulfur. I would say in this case, normally I don't prescribe, but lecithin 3x potency in trituration, along with this LM potency, one of this, it is whether it is cold to touch or hot to touch, or depending on other symptoms, you can give repetition of LM potency and the patient should be better. Yeah, Apis. So that was the blood work is good. Okay, so Apis mellifica, which you have given, belladonna, you must think about. You must think about lachesis. You must think about colchicum and phosphorus also, but in LM potency. I have seen in old age, 90 plus or 85 plus also, I give lecithin 3x along with the LM potency. That works better. Okay. If you get it, it's okay. Otherwise, there are few remedies other also, when if especially it is in lower limb, only in the lower limb, then you can also think about 2 remedies, Rustox also and fluoric acid. But I would still feel that inflammatory remedies are better with lecithin 3x. If you can procure that in 3x potency, works better. Is there any cure for hyperhidrosis in homeopathy? Yeah, you can definitely. Yeah, I've got your question, Dr. Main. It is definitely treatable. Hyper means it is out of control, so you can get that in control. We have patients where the patient says that when writing a paper, he cannot write because everything is becoming wet. So if it is out of control, then homeopathy has the answer. Then you have to take a case and treat that case. Okay. I hope, Dr. Alexander, you prescribe a medicine, then follow up with us so that we also know what is happening. And what happened to that case of urine infection, which was got discharged from the hospital? I think you had given him Staphysaceria. I hope that case is also with you and he's doing better with that. Okay, so let us go forward. So it was related to sensitivity, and in sensitivity it is important because this rubrics will always come to you. Okay, sir, nose blockage always. Sir, nose blockage always during sleep, stingy mucus, very sticky, worm history. Yeah, so if there is a worm history, don't please jump and give Sina. Okay, we have to create an environment in the body so that the worms automatically gets treated. So don't jump into Sina. Now, blockage of nose is there, obstruction of nose, especially at night during sleeping. This is a very common condition. I think in winters also in Nagpur is there. There are a lot of cases where the patient comes and says, whenever I lie down, my nose becomes stuck and I cannot breathe. Then they put some drops. Very common. And you have added that the patient is suffering from liver complaints. So I would tell you few remedies which are important. You can always have few symptoms more, and then you can uh, get the remedy. First remedy you must think. See, there is a very rare remedies also which I'll tell you something. First I'll tell the polycryst and then the rare remedies. Teucrium marum verum. First you must think about. Second is Sambucus nigra. Third is arsenic album. Fourth is kali bichrome, and fifth is aurum triphyllum. Chronic remedies you must think about is lycopodium, pulsatilla also. Now acute remedies that are very handy in prescription. First is agaricus nut, lemna minor, sanguinaria nitricum also works very well. Okay, so Luminium 30 is not. Sir, is there your online teaching course? Yeah, if whenever it is there, I'll just inform you. Okay, nose block, acute agaricus nut. Sir, if Luminium 30 is not available, can it give? No. You can't give that. There's a lot of difference between a dynamic potency and a mother tincture. 30 is okay. If not available, you can procure it. It is not so uncommon. Upper body is sensitive to heat and humidity. Yeah, you have to take the case. If it's a syphilitic expression in the body, there's a disharmony. You have to take a case and give a constitutional remedy. Okay. See, in basically nose obstruction, there are so many remedies. Depending on the symptom similarity, then you can always prescribe the remedy. For example, if you see nose obstruction mainly in the night, then you must think about ammonium carb. Then you must think about lycopodium. Then you must think about magnesium carb. Then you must think about causticum or sambucus also, and naxomic also. Okay, so this is how you have to take it. Then depends on the age. If it is old age, then ammonia is basically indicated. Uncovering the anatom is indicated. Because of this, the patient wakes up from the sleep. Then phytoglycan and mac carb is indicated. So depending on the symptom, then you have to always add that. Okay, so let us go forward. No, I was just telling you something about night. No, you cannot. You cannot give Q. 30x better according to me. So in that, I was just clarifying symptom. Aggravation night, blockage of nose. Sometimes because the blockage is so severe that it wakes up the patient, then the remedy changes. If the blockage is so severe that the patient cannot breathe through nose, then the remedy is different. So when you get a basic rubric, then try to define the other symptoms and get a particular rubric so that you can easily get the remedy. Upper body sensitive to heat and humidity, and the lower body, especially in the feet, are sensitive to cold. Swelling starts on the forehead, and yeah, that's what I'm telling you. Mine. Now there is a disharmony of the body, upper part and lower part. So normally it is a holistic concept, no? So the body has been showing disharmony. In this case, you cannot give a particular medicine. Case taking, repetirization, and then you can prescribe the remedy, the similimum, the constitutional remedy. Sir, primary piles and weight loss and alternate constipation and diarrhea, patient anxious. Piles with weight loss and alternate constipation and diarrhea. Yeah, if there is a bleeding piles, a lot of blood has been lost, so the patient will have weight loss. In this case, there are remedies: naxomica, sulfur, ratania, platina, selenium, thuja, calcarea fluor. One doctor gave him calcarea carb, but after that I felt anxious, so I stopped. No, if the doctor has given you calcarea carb, so don't stop it in between. You go and ask the doctor, and he will definitely ask few more symptoms and then prescribe some other remedies. I think you don't stop it directly. Sir, in psychiatric cases like schizophrenia, since 5 allopathy done, stamina, LM potency available. Yeah, you can. You can give it. In fact, LM potency is advisable because you can repeat that. Already 5 years, patient taking so many allopathy medicines. LM potency is advisable because you require repetition in this case. Yeah? Okay. And LA potency should be given because 6th edition tells us to give LM potency. So I think it's already half an hour up, and thank you for joining me. And I hope you enjoy as much as I enjoy sharing my knowledge with you. Thank you. Until next Saturday. Goodbye.